Hello everyone, you're welcome today to our channel, and if today is your first time of joining us, you're highly welcome. If you've been following us in our previous videos, I would like to say thank you to you, and I want to use this opportunity to thank everyone who has subscribed to our channel, who has shared our content, and everyone who has put on the notification button and are reminded whenever our videos come up. So I would like to say thank you for believing in our content. Today, we're going to talk about something very important about the UK public health specialty training. We're going to talk about the various routes you could use to enter into training. I discovered that a number of people don't know. Many people don't know that there are at least four routes for you to enter into training to become a consultant. So today I'm going to explain all of those in summary. And in our subsequent videos, I will be talking about each one of them in detail. So sit and relax and watch. Thank you and welcome again. So, in the UK Public Health Specialty Training application to gain entrance into the training scheme, there are four ways you could apply through, and I would imagine that only one of those ways is the most popular, which is the national training recruitment that is done once every year, usually in November through to March. So application starts usually towards November, and there are various stages, three stages. We'll talk about those stages in subsequent videos so that you would know exactly what to do at each stage so that you boost your chances of moving on through the three stages of the recruitment cycle. So that is just one of the many routes, like the four routes I talked about. So how do you enter through that route? I talked about that in one of my previous videos, the one on UK Public Health Specialty Training Application Made Easy. If you've not watched that, this is an opportunity for you to refer back to that video to see the various steps there. So there are three other routes apart from this very common route that everybody try to apply towards the end of the year and the beginning of the next year. So the second one is what we call the academic clinical fellowship route. So this is a program that is designed for doctors and dentists who are interested in specialty training but are also interested in research. So NIHR, which is the National Institute for Health and Care Research, have provided funding for that program where doctors and dentists who are interested in both research, I mean, in the academia as well as in specialty training, could use that opportunity. So, for instance, myself, I entered into the specialty training through that route, and it's heartwarming to say that there is an opportunity for you in public health if you're already very research intensive and you're also a doctor who is GMC registered. You could use this route to enter into training, and the training is basically the same thing that they offer all those other candidates who entered through the national training pathway. So it's something you might try, or you can get in touch, and I will tell you how I was able to do it. But meanwhile, I can also do a video on this so that it will be for wider circulation. If you haven't heard about the academic clinical fellowship route, then it's something you could consider. So in that route also, if you've been doing a lot of work around teaching, and like I said, in research as well, you stand a chance of getting in through that route. And it's very good route to enter into the UK public health specialty training. The third one is just newly introduced just last year, and it's the GP public health dual specialty training. Some people, most especially doctors, who have been into clinical practice and don't want to give up their clinical skills or still want to have contact with patients, this is a very good route for you. So it means that you're training as both as a public health specialist and as a GP. And when you finish your training, you're going to have a dual certificate of completion of training. That means you're both a GP and a consultant in public health. If it's something that interests you, you don't want to drop your clinical practice at all. You still want to make contact with patients while you also do things around public health. This is something that you might need to consider. So the last one, I've actually kept this one to the last because not many people are aware of it as well. So you could also become a consultant in public health in the UK by following the portfolio route. So this portfolio route is just about you having a role in public health where you're meeting the competencies that are required of you to become a consultant. So you could be working in local authority or you're working in other organizations that are known for population health or public health, and you're registered with the accreditation body, the UKPHR, where you have to tick off the competencies. Remember, the training in public health is actually competency based, meaning that if you're able to tick off the competencies and you have followed the right registration pathway, you've been assigned a supervisor who sees you through those processes. At the end of attaining all your competencies, you can be registered to become a consultant. So these are the four routes that you could try to explore. Not necessarily the national training scheme where everybody struggled to enter through. And I would like you to consider these ones. You may have other routes that I haven't talked about, so you can drop that on the comment section if you think there are other ways people can become consultants in the United Kingdom as public health consultants. You can drop it there. And before I go, I would encourage you to subscribe to my channel and also press the notification button so that you will see more videos when they drop. And finally, we've got a mentoring platform that had just kicked off to mentor people who are interested in public health and other things around career development, scholarship. So you could subscribe to that mentorship to give you bespoke mentorship. So I will drop the link on the description below so that if that's what interests you, you can join through that. Thank you for listening today, and I'm looking forward to seeing you in my next video. Thank you very much.